Now, as Sydney has entered its 7th week of lockdown, Canterbury Bankstown is the major area of concern, with more than 1,000 coronavirus cases diagnosed over the past month as the virus epicentre shifts there from Fairfield. Latest data shows the city's southwest area also has the lowest vaccination rates. Only 33% of people have received a first dose, and this compares to 52% in the northern suburbs of Sydney and almost half in other parts of the city. Community leaders are urging locals to get vaccinated. Close to 500 people were lined up in Lakemba early on Saturday morning to get the jab. Jihad Dib is the state Labor member for Lakemba, and he joins us now. Good to talk to you again, Jihad. You've got to get those vaccination rates up. What are you doing? Are you seeing a drive, a push for the jab there or not?
Oh, absolutely. Look, I mean, there's been a massive push, particularly in the last couple of weeks. There's certainly an increase in the uptake. And what you're referring to was fantastic. And this was the idea of a community hub. Now, myself and other colleagues have been talking about the fact that we should be looking much more at those local pop-up community hubs. People will go there, go to the old saying, you build it, people will come. And we're actually seeing it. We've seen it at the Lakemba near the mosque. We've seen Bankstown Sports Club, one of the Riverwood community centres. I was there this morning as well. And again, there were hundreds of people lined up. People want to get vaccinated, and maybe it took us a bit of a while to get going, but the community hub seems to be the best model. And I would urge that we do more of those community hubs because people go there, they feel a bit more comfortable. They might bump into somebody they know. They could talk it through. The hesitancy is certainly an issue, but we've just got to get people there. And there's an incredible amount of people who are doing enormous work to put the message out, to say, come on, we can do this. We've got to do this.
It makes sense. You've got to make it easy for people. You've got to get the vaccines to them rather than just have these massive hubs that people have to get to. But there is an issue here. So many of these deaths we've seen lately have been people in their 80s, in their 90s, and their 70s who are unvaccinated. That means that there are people who are perhaps living with elderly relatives in the area who are not pushing them to take them to the doctors or to get them vaccinated. That's what needs to happen, doesn't it? Really, it's great to see everybody lining up to get vaccinated, but people need to get on to their elderly relatives or elderly friends and get them vaccinated.
Yeah, look, definitely. And I think, every loss is terrible. And I know of somebody who's fairly close who recently lost his parents, and they weren't vaccinated. And, we would ask ourselves the question, why was there the hesitancy? Why has it been difficult to get vaccinated? So, of course, what we've got to do is address the issue. The solution is create the vaccination hubs locally, get people to do it. Obviously, some people choose to vaccinate for different reasons, some because of their work, but we've got to make sure that we protect those who are most vulnerable. We know that the elderly are vulnerable. We know that people with underlying health conditions are vulnerable. We now know that the HSC students, to be able to get the HSC, we're going to try and get them vaccinated.
Yep.
The most important thing, Chris, is we've got to change the conversation to say, let's get vaccinated, because not only is this about protecting yourself, this is about protecting your loved ones and the whole community. And as you said earlier...
Just two things I really want to quickly get a response from you on. $300 for a vaccination from Anthony Albanese, that's silly and unnecessary at this stage, isn't it?
You're trying to drag me into an argument here, Chris. I think the most important thing is we've got to get people to be vaccinated. Look, I'd be happy to be able to visit my parents. If I was vaccinated, then they were vaccinated, then I was allowed to go and visit them.
You don't need $300, do you? It's just a silly idea, right?
I want to do it,
You're not exactly jumping in to back your federal leader's policy there. And secondly, there's been criticism of people in
That's what I'd like to say.
There's criticism of people in your area not obeying the rules. Gladys Berejiklian has talked about this. Others are on Talkback Radio talking about this. Do you need to make sure people in your district actually stay home?
Yeah, look, I've heard this. I mean, it's something that people don't really realise is that when they talk about Canterbury Bankstown Council area, that's a population of 380,000 people. We're not talking two suburbs. It's about 40-odd suburbs and 380,000 people. Now, I'm only literally going to my office and to my home. And along the way, of course, I'm driving. I'm not seeing people out and about. Of course, there'd be some that might be breaking the rules, but we're also seeing a lot of transmission in the workplaces. We had an issue recently where one of the takeaway stores, fast food outlets, had 13 people. So I'm sure that there are some people who are breaking rules, and I would anticipate that anybody who's breaking the rules, they should be given the appropriate consequences. But I am concerned at this narrative that everybody's out breaking the rules and that it's lawlessness.
Yep.
It's not that. Let's put it in context. 380,000 people between 40 to 45 suburbs. This is not a small area. This is the biggest council area in Sydney.
Yep, you don't want to smear the whole area with the actions of a few. Thanks for joining us, Jihad. Good luck.
Yeah, thanks, Chris. Thanks, mate. People are doing their very best. That's the most important thing, and that's what we've got to keep doing. Keep encouraging them and get them to go right. Thanks,
Jihad
mate.
Dib there in a lockdown in the southwestern parts of Sydney.